Dr. Mira Keddis, she's a nephrologist, assistant professor down here, great speaker. Once I realized she was down here, I got her speaking at every single conference, and she's getting tired of all the invitations. And she wanted me to say in her introduction that since it's Valentine's Day, you're in love with your kidneys.
Thank you, Dr. Newman. We need to work on newer introductions. I think I get the same introduction every year. No offense there. And thank you for questions in the audience for our previous speakers. This is a beautiful segue to nephrology, actually. Thank you for being here. And without further ado, so I can be cognizant of time, we'll go through things and hopefully we'll have time to answer that plasma-like question that came up a little bit earlier. So today I'm going to talk to you about potassium. And I'm a fond believer that if you understand the physiology, the treatment becomes really well thought out. And instead of being reactive when we see a hyperkalemia, it will be, oh, I know exactly why I'm giving insulin, why I'm giving bicarbonate, why I'm giving albuterol. And this is really my goal from today, is for you to appreciate the physiology, understand how our body balances it, so when you're making those treatments on the spot, these are well thought out treatment plans. I have no financial disclosures. So what we're going to do today is going to talk about the what, the why, the how the body handles changes in potassium balance. I'm going to go through a case that I saw in July of last year, and I think it's a good approach to how you evaluate it and how to manage it. And then we'll hit on some of the newer drugs on the block for management of hyperkalemia. So, have any of you had to deal with patients with hyperkalemia? This is a freebie, hopefully, as a question. Awesome. For the 3% who haven't, maybe you can teach someone else who has. So hopefully this will be relevant and helpful to you. And since it's Valentine's, I want to show some love to my kidneys. Your kidneys do so much. They're so underappreciated. And today we're just going to focus on one thing that they do really well, which is potassium regulation. Where is potassium in our body? And I think I heard a question about, is the potassium from a blood draw? So when we think about potassium, actually the biggest stores are your muscles. So think of all the muscles in your body, and that's where you have the bulk of your potassium. We're talking about 2,600 milliequivalents, okay? What you see in the blood is 4 milliequivalents. So you can see the relative difference between what's inside the cell and what you see when you do a blood draw. When you do a blood draw, this is an extracellular compartment. This is outside the cell. So our body is a huge store for potassium. And then you ask yourself, how the heck did that happen? How is it that my blood supply only has 4 milliequivalents and my entire body has this huge storage of potassium?